I started it yesterday and forgot. It looks like, for the most part, folks do know one another. I think what we'll do is we'll kind of go around the horn. Rick is our MAMES vice president. He's also the Wisconsin state chairperson. So Rick, if you want to open it up with an introduction of yourself.
Sure. Rick Adamich. I'm also the regional manager for AeroCare here in Wisconsin, which was formerly Home Care Medical and Oxygen One. And we're pretty much covering all of southeastern Wisconsin.
Awesome. Thanks, Rick. And I see a couple other phone numbers, a 920 number. Who's that? I want to make sure I'm not missing anybody. An 815 number. Okay. We do have, oh, there's Angie. Angie is just joining us. We do have a couple more Wisconsin board members that, well, one just joined. So good morning, Angie. What we're doing is just having you, the board members, introduce themselves. So if you want to introduce yourself to the group.
Sure. Good morning. My name is Angie Mattheis. I am from Fond du Lac, Wisconsin, from Magnesian Healthcare, which is now a member of SSM Health. And I have been the director of the hospital-based DME shop for, I think, 18 years now. I know I don't look that old, but yep, it's true. And I've had just a blast working with this group of people. So thank you for joining, and I love seeing your faces. So good morning. Happy Friday.
Thank you so much, Angie. We do have another board member who was not able to join us, and that is Steve Huntington. Steve is new to the board. He's our newest board member for Wisconsin, but hopefully, I think he was going to try to get on, but not 100% sure. And then I want to just introduce one other individual who's very active on the MAMES committees and is a chairperson of the Wisconsin Insurance Committee. So Patty, you want to introduce yourself?
Hi, excuse me. Patty Downlinger Bojo. I am with Kinnex Medical Company. I've been the contracting manager there for about, I've been with Kinnex about 15 years, contracting manager about 10 of those. So we've been taking a look at all the Wisconsin issues that come up. There's always fun, always new and interesting things, and looking forward to hearing what's out there because we're all in it.
Yeah, no ifs, ands, or buts about it. So if anybody else wants to introduce themselves, otherwise I think we'll just dive right into it. I know a lot of you already know each other. And then if you do end up talking, if you could just, if you haven't spoken before, just introduce yourself and which company you're from. And then again, folks will get to know you better. So with that, I'm going to open up the question process for you all, just based on what I've been hearing in 7 other meetings. And with the surge, we're starting to hear a lot more about the shortages and lack of inventory for PPE, hospital beds, and concentrators. So I'm just throw it back to you all. You know, if you guys are having those types of issues, and if so, you've had any successes of getting the equipment and supplies that you need.
Good morning, it's Angie again. We have literally skyrocketed our oxygen admissions. We're just a small hospital based and serve about a 30-mile radius from Fond du Lac. And usually we do about 35 admissions a month. And we did 102 last month. And so, and let me just tell you, that was not without challenge in its own, because we have 4 delivery drivers and we have 2 open positions, which never happens to us. And one of them also had COVID. So we were doing all of this with 1 driver and a whole lot of other people who were trying to get it done and thinking outside the box. The one thing I will tell you though is we never had problem getting equipment. Every time we needed more, we ordered it and it came in. And so when people are saying to me they can't get it, That's new to us because we can get the concentrators. What I will tell you is that we are struggling a little bit getting tanks because we were trying to set people up, the COVID patients, on tanks and not some of the POCs and expensives. Like we work with Airgas, and Airgas had some tanks that they could sell us, but when we got them in our hands, they were not even dispensable because, you know, they were so filthy and dirty and not able to clean up. So we just sent them back, and then went to SSM and kind of said, hey, what do you guys have and can you share and can we buy from you? So that was good, but really we're good with PPE. I mean, the early struggles that we had in the beginning are not the same kind of struggles that we have now. Right now, it's more staffing that I think is harder for me right now.
This is Mike Tracy. I'm with Aspirus Home Medical up in Wausau in the Northwoods. And we, very similar to Angie, I mean, we've probably, since the start of this COVID thing back in March, we've probably bought, I'm going to guess, you know, without looking it up exactly, about 400 concentrators. You know, we have quite a bit of volume. We're probably doing 10 setups a day, you know, and we're short on drivers. We've got 2 openings right now. You know, CSR, we have 1 opening we're trying to fill, but we're keeping up. And, you know, I give kudos to my drivers because we're the only company in our area that actually provides in-home setups. The nationals that are in our region are doing porch drop-offs, and that's it, even for oxygen, which I totally disagree with. You know, our guys are fully equipped with PPE and they're going in, and obviously they're doing it right because every one of them have probably been in contact with at least a dozen, if not more, COVID positive patients, and none of them have contracted it yet. You know, we've been pretty lucky. We've had 20% of our staff, you know, test positive and be out, including myself. I have no idea where I got it because I'm probably the most careful person in the world. I don't go anywhere, and if I do, it's with a mask, and we all wear, it's mandatory here. You know, I have my door shut, so I have my mask off now, but we all wear masks in the building all day. That's mandatory. But we had a little surge there internally. 6 people tested positive, but we haven't had anything since probably early October or early November, I should say. But you know, I give credit to the drivers and the RTs because they're seeing patients and in contact with patients every day, and they haven't contracted it. So that's good. Other than that, I mean, yeah, we're having some issues with tanks. We're working with our vendor up here in Wausau at the moment, just trying to get more. We keep running low. We've been really aggressively switching our longer term oxygen patients that haven't switched to POCs. We're trying to, so I run a report every month and I look at tank utilization. And if I see high users, I contact them and try and get them on a POC, just because we're running short on cylinders, and we can't, you know, and it, you know, be honest, I mean, it's crazy, you know, when someone's going through 30, 40 cylinders a month, it's costing us an arm and a leg. I just soon put them on a POC. So, so that's where we're at. You know, everything's been pretty good. I mean, you know, Marathon County, Wausau region has been a hot spot for quite a bit right now. Our hospitals are at capacity, and you know, we're setting up oxygen right out of the ED. They're not even admitting people. So, you know, it's been pretty good. So I don't really have any major issues. We're keeping up. So thank you.
You know, I think with Mike and Angie, and you indicated being short drivers and whatnot, how do you keep your staff motivated, especially when you're this huge surge? Sorry, I'm not sure what's going on there. So can you maybe talk about some of the things you do for your staff that are struggling through this tough time?
Well, I think this is Mike again. You know, we just try to stay positive. You keep everybody in the loop. We have daily huddles with every group. We have monthly, full staff meetings with everybody, and just try to keep everything positive. And I will tell you, with that being said, we are having a record fiscal year financially, okay, even with COVID, even with our retail store being totally closed to the public since March and doing only curbside delivery. We are, we're blowing it out of the water. So we're sharing that with our staff. What that's done for us, a large health organization. We all know the ropes, right? When you're barely making it, it's hard to get any resources. But we are literally 30 times over budget for our income year to date. So that's what that's done, is it's allowed me to hire more people. It's allowed me to look at a new building because we've outgrown this one. It's allowed me to bring in new software. It's allowed me to, buy 400 concentrators and 200 PCs. It allowed me to do all these things that 2 years ago when I first came here, I couldn't get a nickel out of anybody because we were losing money. So it's been very positive, and we try to keep that positive with the staff. We've done some pay increases. We've done some other things, but just communicating and keeping in touch and thanking them every day for everything that they do, and I think we got a pretty darn good team, and I'm proud of them, and they know that, and we're doing a good job, and we keep them focused on the fact that they're front line. Our drivers and our RTs, and they're helping people at home, and they're helping people get through this. We had one referral the other day, 70 liters of oxygen this patient needed with a BiPAP. And I'm like, we can't do it. It's like, really? I'm like, no, I'm sorry, but I can't figure that one out. I've done 25 in the past, but not 70. But the patient was dying in the ICU, and his wish was to go home and die. I think he's already gone, but yeah. So we're getting some crazy stuff, but it's working, and we're just trying to keep everybody positive. We got a great team, so I'm proud of them.
Rose, for the first time ever, we have implemented bonuses. If you work for a hospital base, bonuses aren't as prevalent because they don't do it for a lot of other people. And so retail is hard for them to understand that. But we have sat down and said, look at how much extra call people are picking up. Look at how many hours they're putting in. Look at how exhausted they are. And so we implemented critical pay for our drivers if they picked up extra hours, which only went to the nurses before. And we also implemented bonuses. So at the end of December, they will make an extra $700 based on how many nights they picked up extra. And so I know that people say a lot that, it's not always about money, but right now they're exhausted. And when this is all over, I want them to have a little money in the bank so that they can go on a vacation or do something fun. So I'm actually pretty happy that we were able to do that. And it has kept the people that I have.
That's great, Angie. Are you doing anything for your office staff or just the drivers?
Just the drivers. They're the ones who are working all the extra overtime. The office staff are still doing, they're not, they're working hard, obviously, but their day is pretty normal. But anybody who helps out, like we have a couple people who were drivers before and have taken on different positions. If they come back and help deliver it right now and pick up call, then they're eligible for those bonuses.
Okay.
And it's, it's not like crazy, but it's like $3 more an hour. They get $250 an hour to be just on call. So what we did is increased it to $6 an hour or something like that. And so then when they pick up call, it's good. So anyway, but they don't get that on their paycheck right away. That's going to be wrapped into a bonus at the end of each month.
Awesome. How about other folks? What are you doing to keep your staff motivated?
Well, at Kinex, the team that I work with primarily is our internal team, and they've all been working remotely since March. You know, we kind of took a week and got everybody transitioned over, and that has been it has been a challenge, I think, for everybody to learn how to work remotely and to have that go so suddenly. And I know video chats, calls on a regular basis, all of us managers have been really working hard to keep that communication in play and to communicate how things are going, how things are looking. Because there's all some tough stories, but there's also some really good stories and really great silver linings. And focusing on keeping that communication in place and helping people feel connected. You know, we're at the point now where people have been able to develop routines and have good spaces to work in and are feeling very comfortable and connected working from home. And we've kept that communication with everyone, talking about, well, whenever this is done, what does this look like? What can our new office look like? We've gotten some folks for the first time trained and up and running virtually, which has actually gone very well over the past month or so. And that's been another great lesson learned. So we've been really focusing with our staff on what are those silver linings, and let's take a look at those and focus on those. And nothing helps people's morale more than seeing kids pop into a video chat or pets on the screen here and there. That's always brings a smile to everyone's face.
Even talking about it brought people smiles to their face. How about others? How about you, Jamie? Anything you guys are doing? Jamie, I think you're on mute. There we go.
We just moved our business on the 30th of November, so that was a big deal for us. We've been, we're a different kind of business. We're a sleep lab, and we do, that kind of a thing, and have a clinic and whatnot. And we've really been here through this. Most of our staff have. We've, transitioned our clinic to telemedicine and stuff like that, and it's kind of transitioned back. But, we're doing setups in person and obviously taking precautions and stuff like that. But our staff's kind of used to it, and you're just practical and pragmatic about your approach and just how we clean the building and clean all of our spaces and stuff like that. So the staff's been great about that. We had weekly staff meetings. We have a bi-weekly meeting now, where we're always communicating and catching up with the staff. So that's been a big piece for us. Communications can be an issue for a lot of companies, and it always is for us as well. And so that's been helpful. Just over communicating. Initially, I was infusing a lot of information about, because we have a medical director. So I have an ICU physician who, and a lot of you individuals work in hospital settings. We're fortunate to have a medical director who's a pulmonary and ICU physician. So he can give us kind of a up-to-date information on what's happening. We can talk about, different things, and can provide the staff different types of things. And that's been helpful too. So we've tried to acclimate and obviously have PPE and shields up in our clinic and stuff like that. So it's something we've gotten used to. We're not sure what the other end of it looks like, but we're surprised at the number of patients that actually walk into the building and are willing to come in for a setup. We've obviously do remote setups for CPAP and whatnot, but still surprised that more patients that come into clinic and come in the building and stuff like that. We don't obviously allow our staff are all in masks, and they're not allowed to enter the building without a mask on. So we've kind of gotten used to that, and the staff's been really, really good about it.
Rose, can I just share one more thing? Because this was a big topic for us yesterday. We had a staff meeting, and one of our annual goals, we call them catchball goals, is to prevent burnout. And so we just did a brainstorm with the team. There were 65 of us on a call, and it was all, all of our staff, no matter what they did. And we said, just talk with us about what are some things, we know your world is different. What are some things that will help prevent burnout for the next coming years or next coming months. And, you know, I forget that it's not just the people out working with the patients who are working 100 hours. It's my floor staff who their world has changed because they don't have patients coming in anymore. So they have to try to, you know, sell something where nobody gets to see it anymore, but they still have to do it, you know, so their life has changed too. But some of the things they said was, you know what, it would be really cool. We would feel appreciated if you had healthy snacks in the refrigerator. Just have some yogurt and juice. You know, how much, or water, how much does that cost? But wow, that would be nice. We feel appreciated. Could we have bring your dog to work day? You know, I mean, silly things, but really they were heartful, and they said, that would be awesome if somebody once a week could bring their dog to work. And you know what, the store's closed. Why not? Why can't we do it now? If there's certain things we can do. We didn't decorate the showroom with Christmas decorations this year because it's closed. And they said, but wait a minute, we're still here. Let's decorate, you know? So I think we have to ask them, because they'll tell you. And I came up with some really great ideas that we're going to do in the next 30 days that I hope will help, you know, bring some happiness back. So.
Real quick, this is Rick. I just have a couple questions. One, we are seeing with our CPAP setups, we offer the remote option, and it's amazed me how few people actually take advantage of that, even though it's offered. And so I'm interested what people are seeing. Are they doing more in-person or more virtual type setups? I'd say it's a small fraction of what we do, and we do quite a few CPAP setups every month. So that's one question. The other one is I'm hearing a few of you having your stores closed, and I'm wondering the thought process behind that. Ours was pretty much closed at the beginning of the pandemic, and we reopened, and we're very busy. We have a lot of foot traffic, obviously taking precautions. So I'm just wondering what the thought process is for why you're staying closed, and or, you know, and doing curbside drop off and all of that, and what will it take for you to reopen? I'm just curious, because I look at retail across the board outside of our space, and, you know, none of these places are shut down completely. You can go to the mall and go in everywhere. So I'm just curious about that for those of you that have retail storefronts.
Well, I can speak to that. This is Mike again. We've just made the conscious decision to protect our staff and our customers, because here's the deal is all of our customers that do come in, we do stuff by appointment, and then they call us from the parking lot, and then we let them in. We check their temperatures, ask them, you know, all the questions, and then we wipe everything down. So we bring in into each setup room one at a time. We set up an area in the retail store where we can do like, you know, setups and instructions for Billy blankets and nebulizers and things like that, but it's just one at a time. You know, take all the precautions. Our staff wears masks, face shields, the whole works. You know, we just feel more comfortable with that, you know, because as I go out in the public, I'm telling you, most people are stupid. Okay. I mean, everywhere I go, you know, I'd say half the people don't have their masks on, or have their nose hanging out, or have their mask under their chin. And, you know, I've confronted people. I've given up on that. I'm not going to get in fights. It's just, you know, just stay away from them, you know, but I'm just not going to allow the general public just to walk into our store willy-nilly and infect my people, which then will infect everybody else, and in turn infect our customers that are already compromised. So for me, the retail sales side, I mean, we're still selling just as much stuff as we were pre-COVID. Not where I'd like to be, but you know what? That 50 grand a month that we're not capturing is nothing in the grand scheme of things, you know, for us financially. I mean, we're having a record year without it, and we'll come back. We'll bounce back to normal. So we took that precaution just because, you know, just didn't want to just let anybody in. But people are allowed to come in. They just have to call. We screen them. We monitor their temps. You know, but I just don't need gawkers, you know, strolling through the store for a $10 sale. It's just not going to happen. That's kind of where we're at.
Sure. It's just interesting to me because one of the observations I've seen, and this is anecdotal for our space here, is that when I look at my staff infection rates and who is coming down with this, because obviously we track that, it is interesting to me that my frontline staff, my delivery drivers, my respiratory therapists, people that are involved in direct patient care, very few of them have contracted this. It's all my office staff, the people that are going, you know, that are in the office or even some working from home that are the ones coming down with this. And I just thought that that was kind of counterintuitive to what we're experiencing. And I just didn't know if anyone has tracked that and seen that in their own population or if that's an anomaly for us.
Well, that's exactly what we've seen. Everybody that contracted COVID here, which is 20% of our staff, we're all office staff, and myself. The only thing I can come up with is I probably touched a doorknob. That's it. I mean, that's the precautions that we're taking. I can't figure out how I got it. But there were 6 other people that all tested positive within a 2-week period, or 5 other people. So, yeah. So, yeah. But the people that are facing customers aren't getting it. Go ahead.
Rick, you know that we have a large showroom, and so it was really hard to make that decision to close down. So we did right away when there was a panic and, you know, what is this going to look like? We were closed for a couple months, and then we did reopen. But when Fond du Lac was hit very hard, we closed again. And so we've been closed for about 30 days again. And we want to open, but we are finding that we have learned how to do this business just like it was before closed. And so we're meeting everybody's needs. If we weren't, we would be open, but it's safer for everybody. And we're doing just what we were before. Again, appointments, we do appointments. We did have to, the last couple of weeks, close down our compression because the numbers rose so high in Fond du Lac, but we're doing compression virtual. And we've had a couple of those and that's been successful. And we are also offering it, like you said, for CPAP setups, but like 1 out of 50 might take it, which surprises me. Doesn't that surprise you, Rick?
Mm-hmm.
Yeah, I know. So I thought it would be a great convenience to everybody, but nobody takes it.
Talking about remote setups, there was a period of time there where we weren't doing any in-house setups and it was only remote. Well, I'm going to tell you, the patients, most of them fought back on that. But I will also tell you that when I tracked that all the remote setups versus the ones that we did in-house, the compliance ratios were unbelievably different. I mean, huge difference. So we've gone back 100% in-house setups. We do about 150 a month, CPAP, BiPAP, whatever. They're all scheduled in-house. We just take the precautions, you know, screen them and wear face shields and masks and the whole works. And you know, and we're getting much better compliance ratings. We're up over 90% now again. So, you know, that's pretty remarkable. So I just, there's a connection, in my opinion. What I've seen is there's a connection that's getting lost with a remote setup, especially when you farm it out to another company that doesn't have skin in the game. So we've pulled it all back in-house.
Hi, this is Jeff. We're doing all remote setups right now. Our compliance is still pretty high. What we're doing is a 7-day, 14-day, and of course then the 30-day phone follow-up if the people are non-compliant. Seems to be working good. We've also closed our retail locations. Quite honestly, the model I see, and we're kind of like you, Mike, we're having the best financials we've ever had. Part of it is there's a lot more efficiency in the model we have now. Instead of somebody coming in and we spend an hour trying to help them select out a walker, those days are kind of over, I believe. And it's just created an efficiency for our staffing. So we've really redeployed a lot of our retail staff back into the main HME experience, taking orders, processing orders, you know, and getting things shipped out. I think the one benefit we may have had going into this is our system has a census of about 200 patients on hospice. And so we're quite used to, you know, quick increases by the day on the amount of setups we have. So we were kind of built for this already. In a way, we have had some issues with oxygen tanks. And some of that is the suppliers that they've had COVID issues in their facilities. So they've been unable to fill our tanks and get them back to us quickly. And that's really been a concern. Although a couple years ago, we had some things happen in the system where we were a little concerned about oxygen supply, so we did stock up on tanks. Right now, some of that is really paying off that we have extra supply.
This is great. Anybody else have something to share? I know, Rick, did you get enough feedback on the whole? Because I think that's interesting that Mike found out that the remote setups have lower compliance rate. I've not heard that on any other call. So that is pretty interesting. Is anybody else tracking the differences?
Yeah, this is Dave with Chartwell. We stopped all setups immediately in March, and then realized that this was going to go on for the long haul, and so we did go to remote setups, and with our staff doing the training, and we did notice an initial downslide in the compliance. So we've been monitoring that and watching that, and we keep tweaking our processes to help improve that. And we are definitely right back up where we belong. And we were able to catch that in relatively short order. We will allow for some in-house setups, but that's few and far between. We really do try to keep it with the remote. Interestingly, we just opened our new building that had a showroom, because where we came from, we had a show corner. It was a small clinic, and now we've got a showroom, and then all this hit. So we have not even set it up and used it yet. Part of the thought process there, though, is we've gone through 2 mergers and acquisitions in the last year and a half. So we went from UW Home Health by ourselves, and Chartwell Midwest Wisconsin, which was an infusion enteral company by themselves. We merged in 2019 and started building the new company and building and warehouse with showroom. And then we acquired Unity Point at Home this past July, and are still working with that computer conversion, melding the 2 programs. And they had a showroom, so we were excited about having a showroom, and then this all hit. So we haven't really used it. But one of the big reasons is that our patient entrance also is the entrance for our ambulatory infusion suite. So we have very tenuous patients coming in for infusion therapies, and so we had to make that conscious decision to protect those people. But we are doing more CPAP setups than ever, and virtually all of them are remote. And again, we've been tweaking. It was a process of learning what we used to do, but now do it kind of differently with some of that follow-up, and things kind of threw everybody a little bit kittywampus, because they're working from home, and now we got to do call. Even though it was the same, it was different, and so that was part of our growing pains and lessons. But we've been very successful. Angie, I'd really be interested to hear how you guys do remote compression, because that is one of the things we do. We still do our CareWare product line in-house by appointment, and all of that, and that is the compression stockings and the mastectomy product line. So the fitting of compression remotely is intriguing.
Well, it's going to be we just started, and it's going to be one of those things that we're going to learn lessons from. But having that visual that we're sitting with the patient, I'm on this side and they're on that side, and we can see what they're measuring, and we're showing them exactly where to measure. It's not going to work for everything, because when the rules all go back in place, I think that the fitter for MA has to be, the one who's actually measuring it. But right now it's working. And I see it working really well, because, there's a lot of times where we can't get like the truckers in at the right time, or, those people that really are swollen, and we can't see them at the right time. So if I can do a virtual visit when they're at their lowest, and I can walk them through this, that will be good. Some of the difficulties are going to be with the elderly who probably can't get it on, and those are the ones that I'm going to still need to see. But we have a lot of younger people wearing them now, and
Sure.
they're the ones that you can do those virtual appointments.
All right. I'll share that with the CareWare team.
Yeah,
Dave,
and
you'll be able to open your retail space by July. I'm confident.
By July, all right. A year later, we've got a stack of lift chairs that came with the acquisition that have just been sitting there, and scooters are up in our office space, and we are still doing some of doing the rehab and whatnot. But it is the showroom. We had great plans for this thing, and we never set it up.
You got something to look forward to.
Yep.
See, I got a question real quick for you guys doing the remote setups. One of our struggles, other than what I mentioned previously with the remote setups, is we had a hard time getting paperwork back from people. I mean, it was just horrible. I mean, I'm going to say at least 20% of those that we did remote setups back, we had to hound them and beg them to get the paperwork back. One person I actually had to bill privately for until they got the bill, and then they called and finally got us the paperwork so we could turn it back around. But that was a nightmare, and I don't know how you guys handling getting the paperwork back signed and back.
Well, with our remote setups, it's actually our drivers dropping off the equipment, and so we get it signed at delivery.
Gotcha.
And then the RT makes so we've got a process of what we call whip states, work in progress, and so once the tech gets it back and delivered, it gets whipped to the RT team, and then they make the phone call and do all the document of the training and whatnot that way. And then of course we've got the downloadable machine, so we've got proof of compliance and usage that's
Yep.
going on.
Okay,
So,
we were shipping ours out through a shipping company.
We were shipping ours out as well and utilized DocuSign, but even with DocuSign, it's still the same thing, even though
they still were ignoring it. Yeah.
Yeah. So it's frustrating. But yeah, I've had a few of those challenges as well. Not a lot, since so few of our patients are actually electing for that option. I also think that, this is just my personal opinion, that you really have to be, I can understand going all virtual, but there are certain patient populations that, in my opinion, are not appropriate for a virtual setup. If you ask my mom to do a virtual CPAP setup, she struggles with her stinking mask anyway when one of our RTs goes to her house in Colorado. So to do a virtual setup with somebody like her, it's just never going to work. She's guaranteed non-compliant. And so I think it's really important that there's a screening process, which I don't think we had in the first place. With some of ours, it was just if they elected that option, there was no criteria. And I think that's a really important piece if you're going to do virtual setups. And if that gets missed, you're guaranteed to have lower compliance just by default.
Sure. Good stuff.
So I have a quick question. A few of you have mentioned that you're having, this is Craig from VGM, by the way. For those of you that I don't know, I know most of you, but some of you mentioned that you've had record years. Is that sheerly there hasn't been a decrease in volume for you, or you've got an increase in volume, or did some of the financial stimulus packages help that from a revenue perspective, either paycheck protection or HHS provider relief funds, stuff like that? How is it that if you're closing down your retail part of your business, you're doing as well as you are financially, having record years? Is that through acquisition? I'm just curious where some of that's coming from.
So for us at Aspirus, it's multifaceted. So I came here about 2.5 years ago. We had a mess. All right. So we've been day after day, week after week, month after month, we've been doing quality improvement process, on everything, changing things up, the way we buy things, how we buy things, how we provide things. Everything has changed. I just basically dumped the apple cart out and we're putting the apples back in one at a time. In the meantime, 6-8 months ago, we switched computer systems. Our old system was just a piece of crap. Half the billing wasn't going out right. It was just a mess. So we've transitioned that over. We discovered that we had at least 100 auction patients that were past their 5-year renewal. Some of them out 10 years.
Yeah.
that we never touched out to.
Yep.
So, but we're shipping cannulas to every month, and we're delivering tanks to every week, so we've cleaned that up, and we've got the systems in place to do that. Our rehab, our ATP guy left, and our profitability increased substantially after that happened. Okay. We were losing our shirts on complex rehab. I mean, complex rehab is a great thing, but I'm going to tell you, and you guys that do it know this, if you screw up 1 out of 10 chairs, you've lost money.
Yep.
In this day and age with the way
those are expensive
reimbursement is.
mistakes in that field for sure.
So we've, so that's helped. And then volume has increased substantially. We're managing somewhere around 6,000 or 7,000 CPAP patients right now. And we got a really good CPAP resupply program that we've put together. And that's just, I mean, we're shipping out about 700 or 800 packages, 3-month shipments every month, about 700 or 800 of those. And, and all of our ostomy, urological, diabetic, and wound care supplies are all being drop shipped now. They're not, we're not even stocking them and ordering. We're just drop shipping through portals. Compression, anything other than the standard is being drop shipped right to the home. We're not stocking that stuff. So we've just streamlined a lot of things, but, over a 2.5-year period, it's, we've gradually seen the improvement, and that's just where we're at.
Okay.
But the volume is up as well. And I'm excited about post-COVID because we're going to get some new space. We're going to expand our retail and do some crazy and creative things. And I think things will get blown out of the water even more. And we're also looking at some other programs that we haven't done. So, it's just, the future's great. And the nice thing is I'm in a position right now to be able to do these things because we're making money.
Yeah.
You know what I mean?
Yeah, so that's great. Thank you for sharing. These were initiatives that were already in place. You were working on them prior to COVID, and you're starting to reap the benefits of some of those changes. Has the pandemic given you some of your staff some extra time to really focus on some of those changes as well, or this is stuff that you've been gradually working towards no matter what? These were priorities for you.
It's been, staff involvement, commitment as well, and just a long process. But the volume has definitely increased, and I think COVID's done some of that. I mean, we've increased our auction load, with the COVID and stuff like that. But I don't think that's what's making all the money. I mean,
Sure.
It's obviously not. But it's just it's a lot of pieces to it.
All right.
But
Very
we're
good.
we're finally there, and thank God, we came into this thing healthy, and we're going to leave it healthy, and then we can only go from there.
This is Jeff. One thing we found interesting is we've built a pretty strong ventilation program, and when COVID hit, we sure expected to have that increase. But some of the physicians became a little more leery about ordering vents because they knew there was a shortage. So it kind of stopped our growth there. But we run somewhere around about 120 patients or so, and that's what kind of helped us out financially. And we also started up a consignment program, and that was a few years ago. But now with our system, I think we finally topped about 70 locations in the system for consignment. So that's just ongoing revenue, having those two programs built. The other thing we looked at, much like Mike, we looked at what was profitable and what could we scale up without adding FTE. And of course, as you guys all know, using e-purchasing and drop shipper for CPAP supplies, you can really, put the pedal to the metal with that without increasing too much staff. So those have really been our focus, is those three areas we look at as being extremely profitable, and have really pushed for those. And so we have moved some of the retail people, our staffing, into those product lines to help support them and to grow them.
Really interesting stuff. Anybody else want to share? I can tell you there was one thing that was consistent throughout all of our meetings is all the differences that people are doing regarding the handling of the cleaning of the equipment, COVID equipment versus just regular equipment. we've heard pretty much a myriad of everything. We've heard providers are still quarantining their equipment for 14 days. One indicated 7 days, one indicated 5 days, one indicated 3. Others have said, you know what, we treat all of our equipment the same, and we're confident that we're using the appropriate cleaning solutions and whatnot. So we do not treat them separately. We clean them all the same. So I'd be interested to hear some of the feedback from you all, how you handle COVID versus non-COVID equipment.
Well, for us, we treat everything the same because, you know, there's other bugs out there other than COVID that probably could be worse on some of this equipment, like MRSA and other things. So, you know, we treat everything the same, and go through the process of total disinfection and you know, bagging and quarantining and all that kind of stuff. So I don't see COVID as being any different myself.
Yeah, same on Kinex's part. I think in the first month or so, we had a kind of a quarantine area for our equipment, but you know, after taking a look at everything and reviewing our procedures, we really felt what we had in place was very good disinfectant to begin with in that process. So all of our rental equipment, we've been keeping the same procedures on.
The only thing we've been doing to, go ahead, Jeff, sorry.
Yeah.
I was just going to say, we do quarantine our equipment. We're doing 3 days on most of it. On CPAP, we do 10, just to be a little bit safer. Our concern was the areas that we couldn't get the disinfectant on. So the outside, like our drivers, they roadside clean everything. They'll clean it on the patient's porch. They'll clean it before they put it in their van. Then when it comes back in, it's sprayed again and placed into a quarantine area. So we've been doing that. It has been a little bit, we do run into some space issue down in Rockford. Janesville, we have a very big warehouse, so it's not an issue. Here it's been kind of a problem. And as I said, with like the census for our hospice patients, quite a few of those patients do have COVID. And so there is a lot of equipment turning, and that has been a challenge.
Interesting.
You know, at first, I think I'm off mute. Can you guys hear me? At first, we did all that, you know, quarantine for 3 days, and when we can, we do. But with the concentrators, they're coming in so fast that, I mean, you're doing everything you can to keep them as safe as possible, but you can't keep them in. I can't keep them in 3 days, so I can't quarantine them for 3. Yeah.
My thought is on the concentrators, if you disinfect the cabinet and everything that can be touched and stuff, and then change out the internal filters, I mean, I think is totally safe. And what we do is CPAPs that come back in, they get disinfected on the outside, but every CPAP that comes back in gets run with soap through the unit one time, just to disinfect anything, you know, in the blower and everything else. I know ResMed doesn't like that, but I mean, a one-time thing is not going to hurt a blower. And we're finding those machines, even the ones that came from smokers, I mean, the air quality is very pure coming out. Just run them through a soul clean cycle one time. So that we implemented that about a year ago, and we've been really happy with that.
Yeah, we always used an ozone closet for our smoker concentrator units, and so we've just kind of expanded that with our concentrators. So rather than quarantining them for a number of days, we have a dedicated room that's way off from everyone else, and we have an ozone machine that we use for that, much like the So Clean.
Cool. So what kind of ozone machine do you use to fill that room up with the ozone?
You know, I'd have to look at what it is. We have two at 2 separate locations. One's one of those like hunter, like smell off closets that you can get on Amazon.
Mm-hmm.
And that's just, it's smaller. And then we have a bigger, more powerful one I'd have to look at, again, it's just an Amazon purchase, and it's like a small, like 8x10 office that we just throw our CPAPs and our concentrators in, and they just time it and then let it air out and then go in and finish the cleaning process.
Interesting.
Mm-hmm.
Mike, how long is a SoClean cycle?
I think it's like, if I'm not mistaken, like about 45 minutes or something like that. I don't actually run it, so I don't know for sure, but I think it's pretty close to that.
It is.
Did any of you guys ever have that that SoClean Pro Lab, the large one, that they sold and then pulled back?
No, I never had that.
Okay.
Anybody, I do show we're coming up about 4 more minutes left in the hour. So, so far, this has been great discussion. Is there anybody else that wants to ask a question that maybe hasn't had an opportunity to talk yet, or any last minute questions you have of each other? All right, well, not hearing any, I would love to get your feedback if you think this session, this type of session was helpful for you. Is this something that you would like to see again in the near future? Any feedback?
Well, I think it's been very helpful, and I think it's good, you know, to be able to get with our peers in this industry and talk about some things and get some ideas. I think it's great. I think we should do it monthly.
I would love to see some topic specifics cycle through, you know,
Yeah.
one talk about revenue cycle and talk about operations, and, you know, maybe talk about some of those respiratory challenges. But an open floor is always a good thing.
Great. Anybody else? All right. Well, what we'll do is I will work with our board, with Rick and Angie and Steve. And we'll definitely, I like the feedback that we're getting. In fact, most of the folks that have participated on these networking sessions agree the same thing. And, you know, COVID is coming to an end. And so, you know, there's been discussions about, you know, post-COVID, what are people planning? Because, you know, now there is kind of that light at the end of the tunnel with the vaccine coming out. There was great discussion on our provider and owner executive management committee of just, you know, the thoughts people had on whether or not they would get the vaccine. So it's just been, it's really great to kind of have that opportunity, since we can't be face to face right now. You know, and at least we know it's going to probably be, you know, probably mid next year before everybody gets vaccinated who wants to be vaccinated. So again, there's still going to be a lot of issues, but we can't stop life. So just stay tuned. Make sure that you continue to look at the MAMES FYI. We'll send out special alerts if there's anything that's popping up. But with that, Rick or anyone else have any final comments before we leave?
No, just thanks to everybody that joined the call, and I do think it's valuable to have these conversations on maybe a monthly, regular basis. I think Patty's right. If we create some agendas going forward, some hot topics, that would be wise. Also, for those of you that are in you know, owner or executive management positions, we do have that POEM committee, and we talk about this and other business related things on a monthly basis too. So I just kind of want to throw that out there. If you're not on that committee, it's beneficial, it's interesting. And like she said, we're talking about last month, I guess this month, talking about vaccinations and stuff that's maybe not totally germane to DME, but still very interesting and helpful to hear about. So if you're interested in that, reach out to Rose, and there's a process for joining that committee. So that's all.
Awesome. Well, thank you very much. And again, thank you to all of you. We hope you have a very happy holiday season. And if there is any follow-up that you have any questions or want to share, make sure to just send us an email. So with that, thank you, everybody. Have a happy holiday.
Thanks, Rose.
Yep.
Thank you.
Good seeing everyone.
Good to see you too.